Welcome, everybody. My name is Scott Barrett. I'm a professor in the School of International and Public Affairs and the Earth Institute at Columbia University. And I am joined by our co-host, Jeffrey Sachs. Jeffrey is a university professor at Columbia University, a professor in SIPA and the School of Public Health, and director of the Center for Sustainable Development. And we're joined by Yanis Ben Amour, who is an adjunct professor in the School of International and Public Affairs and executive director of the Center for Sustainable Development. Jeff and I are economists. Yanis is a molecular biologist. So we're going to have to combine these disciplines. That's part of the whole point of this seminar series called COVID-19 Policymaking in the Throes of a Global Crisis. And our speaker today is Suresh Naidu, who's a professor both in economics and the School of International and Public Affairs. And he's going to speak on workplace collective action, unions, and worker health and safety in the COVID-19 pandemic. This is based on joint work he's been doing with Alexander Hertel Fernandez, who is a professor in SIPA. Suresh, just very briefly for an introduction, Suresh has done really amazing work in the area of political economy and labor economics, with issues ranging from the effect of laws on workers from slavery through Jim Crow to the modern era, including looking at the effect of monopsony power by powerful industries suppressing wages and changing the nature of the workplace. So Suresh, welcome. Thank you so much for joining.
Thanks.
We're going to have you speak for around 20 minutes or so. And then Jeff and Yanis and I will ask some questions. And we have students who are taking this webinar as part of independent study. And we're also going to be taking questions from them, and I'll be directing them your way.
Great. So I'm also going to present some super preliminary stuff on what's happened with the unemployment rate around COVID in the US and the policy response to the unemployment rate. So that's why it's like one of the many interesting new things about COVID, the economy, is that it really bifurcated the low wage labor market into like essential workers that were, basically like had, if anything, like heightened demand for their work, and then laid off and unemployed workers that then immediately had an incredible collapse in the demand for their work. So it's an interesting sort of thing to look at these kind of two different labor market experiences that have sort of happened, particularly in the bottom end of the labor market. So I just want, you all have probably seen graphs like this, but it's just, the off the charts nature of the unemployment shock during in March and April. It's like, take that increase that you saw over the whole scope of the Great Recession and then double it and make that happen in a month. You'll have kind of like something approaching the scale of the unemployment shock that the U.S. economy experienced in the first quarter of the year, and then it's been slowly coming down. But I don't think anyone really thinks it's going to come back to where it was for a long time. What's also interesting about it is that it's really concentrated at the bottom of the labor market. So you should think of like restaurant workers, in-person retail. These are really low-wage sectors of the economy. They also are person-to-person services, and these are the sectors that have like just really got hammered by COVID. Even before there was any formal lockdown orders, nobody was going to restaurant. Basically, as soon as this pandemic took off, these kinds of services were just like we're losing business and laying off workers. And so this unemployment rate and these are not jobs that can be done remotely. And so the unemployment rate just went through the roof disproportionately in these low wage sectors. And sort of like what's, I think, somewhat interesting is that even for those people that remained working, they didn't experience much of a wage increase. So what this graph is two wage series for individuals relative to wages relative to like February the 15th. And one of the interesting things is that like if you actually just looked at like average wages, they actually jumped like by about 6% from February to March. But that's because all the unemployment was concentrated at the bottom of the wage distribution. So nobody, like basically you chop off the bottom part of the wage distribution, average wages look like they're higher, but that's just because all the low wage workers have lost their jobs. And so when you actually do this like selection adjusted version where you're trying to look at workers that were just through the economy the whole way, that's a flat line. And I find that flat line interesting, and that flat line is there across, even in like food service, those food services that remained open in medicine, even in sectors where like, and this is like some evidence from some surveys that we did where people were really worried about getting infected at work. And what economic sort of theory 101 would suggest is that there should be some, for those people staying on the job, you can imagine that there's some sort of compensating differential that, in the context of a pandemic, that you would need to be paying like some sort of higher wage in order to get these people to show up to work. And, you can kind of see that people are, this is a survey of essential workers. These are the people that were still on the job. You can kind of see that, there's like even among the lowest wage workers, there's like an increased percentage reporting that they're very concerned about infecting themselves at work. That's stronger in Black and Latino communities, and stronger among young workers. So there's this like heightened fear of getting infected, and infecting, I think also, like, even if you're not going to die from it, you're in family networks and housing that will expose, people you care about to this, and that probably bothers you. And so what I sort of find interesting about this is that, there's no compensating differential. So this is like the distribution of wage changes from the same survey where we asked people like, what was your wage in February? What's your wage now in like April and May? And regardless of your, like basically the first fact is this giant spike at zero. There's like no wage change is the modal response. But there's also no, like even in the high COVID places, there's no like extra mass on the positive side of this that would kind of suggest that there was like, oh, in places where COVID was really sort of taking off in March and April, that there was no sort of sense in which wages were getting bid up to like offset this additional worry. And that sort of makes sense, because if you think of your wages, you're only able to get this compensating differential to the extent that you're able to like quit your job and leave for another one. So like what should create the bidding up process is having some stiff labor market competition. But when the bottom falls out of the labor market, the threat to quit is just not credible. And so you can imagine that there's not really any need to kind of, there's not really any threat of your workers quitting that would force like an employer to have to pay higher wages. And plus, demand is also falling for your own, chances are you're cash constrained if you're a grocery store. And so you might have like might not be able to pay it. But so I think that's one interesting thing was like the lack of a compensating differential for essential workers in the early parts of the pandemic for those that stayed working. One thing I did also think was interesting was just like you can kind of really see where unions make a difference in the workplace with the response to COVID was in unionized workplaces, you basically got a much more effective delivery of personal protective equipment, of social distancing practices. Even if you didn't get necessarily a higher wage, you got paid sick leave. You were more likely to get a test, and so unions kind of like acted on behalf of their members to kind of get they're not all heroes here. Like a lot of unions also didn't know exactly what the right thing to do is, and so they were like, we don't need masks. But on average, it seems like unionized workplaces really were good about getting their members health protections. I'm running out of time, so I will skip this. Well, actually, let me just talk about this. One of the interesting things that sort of happened with COVID among the essential workers was just like this rash of mini strikes. And it happened in Amazon workplaces. I don't even think we heard about all of them. It happened in Amazon warehouses, it happened in meat processing plants. And a lot of them, like particularly the ones in the processing plants, were illegal. And sort of one of the interesting things was like your willingness to participate in these kinds of like workplace collective actions as a function of your concern about health risk was kind of a question that we were asking. And that seemed to be like interestingly perhaps unsurprisingly increasing. The more you were worried about getting infected at work, the more willing you were to do something about it in the way of workplace collective action. What I find also interesting is that's true not just for like Democrats in blue cities, that's also true in among Republican respondents. And so like this kind of like interest in unions and collective action was kind of magnified by COVID risk, even among sort of like quote unquote conservative populations. Okay. So let me now switch gears and talk about the unemployed. So I just want to like just say it as much as I can, is like the CARES Act is possibly the most progressive piece of policy that was passed in my adult life. It's like, it was like, and for not great reasons, but kind of by accident. So there's a bunch of components in the CARES Act. There's stimulus checks paid by the IRS. There's paycheck protection given to businesses. And I think like the biggest piece of the relief puzzle that the CARES Act did was expanded UI. And partly it's because there was an experience and a technocratic body of policy expertise around how to do expanded UI from the Great Recession. So people were like, expand state level unemployment insurance facilities, top it up with transfers from the federal government. And so there was like a playbook to how to expand UI that could get used. And that UI was really kind of like the instrument that was up to the scale of the recession. And I mean, it's not a great instrument because UI is administered by the states and different states have different benefit rules. I mean, it's great if you're an economist because there's tons of policy variation, but it's probably not great. So Florida has a really flinty low UI replacement rate. New Jersey has a pretty high replacement rate. But what the federal government did was it topped up the UI replacement rates with $600 a week on top of whatever the state UI system gives. And just think about how much that money that is. That's $15 an hour. That's equivalent to like $15 an hour times 40 hours a week. And that's across the board. So if you were like a low wage worker in Mississippi and that got laid off, you were now getting $600 a week in UI, which is more than you were ever making on your job. And one of the reasons they did this is because it turns out like in the heat of the moment, it's too hard because all the UI programming systems are implemented in basically Fortran or something. There's like, or COBOL, it was too hard to update the UI systems to do more subtle or complicated UI adjustment rules. So it was just like, all right, $600, let's go. And that was what was like kind of feasible as a policy rule because of like the technological constraints of having to update all the state UI systems. And other things that the UI system did was like it made independent workers, like gig workers, eligible for the UI system, which is then interesting because none of their employers had ever paid into the unemployment insurance system. So Uber, et cetera, had never paid into the unemployment insurance system, but now their workers their quote unquote workers were drawing down on UI systems. So that's like another case for putting independent workers under coverage of employment laws, because then their employers would have to be contributing into the UI system. And so one thing I've been working on is just sort of tracking what workers have been doing since July 31st. So the CARES Act expired in July 31st, and people all of a sudden, like, that $600 just went away. And in some states, they brought something back with like this lost wage assistance program, but in a lot of states they didn't. And so commentators, for example, were saying that, like, oh, once the CARES Act expires, we're going to really be headed into a really big recession, because that boost provided by the stimulus by this UI system would go away, and we'd see a much worse recession, which we haven't, and there's a good reason for that. So this is just a map of showing the greater than 100% replacement rates, which makes economists like head explode. They're like, it just can't be efficient to have like a greater than 100% replacement rate, is like what sort of a bunch of economists in this space were saying. But I think it actually made a lot of sense, given what happened afterwards. So this is just, replacement rates greater than 100%, almost like across the country. And in particularly low wage states like Georgia, West Virginia, Kentucky, you had replacement rates like above 150%. So you were making more than 150% of your wage as a result of the UI expansion. All right, so this is what, two more graphs. So this is just something I've been working on with kind of this financial service. There's basically a low wage financial services company that given us access to like their transactions level data. And so we have like basically 2% of all of the UI recipients in the country in this data set. And this is like the inflows into their bank accounts separately for the people that got UI in July and those that did not get UI in July. So what you can see in this graph is this is the initial stimulus payment, that first spike. That's like getting the checks from the IRS, the $1,500 checks. And then there's like, this is like getting your tax return in April is the second spike. And then you can see like this divergence between the people that are getting UI and the people that are not getting UI. And that sort of, opens up in May, and then it persists. And then at the end of July, it falls. And so now you're not getting that inflow. Now note that if people were immediately like getting back to work when they were kicked off UI, you wouldn't see inflows fall by this amount, because people would be finding new jobs once they got kicked off UI, but you don't see that at all. So people aren't getting jobs, they're just losing the UI payment. And so that's important. So if they're not getting jobs and they're losing this $600 a month, why haven't we seen this big fall in demand? Why haven't we seen this big recession? And the answer is that people saved a lot of their UI checks. And so basically, like, this is the end of week bank balances for that same population. So basically, while the people that didn't get UI were like drawing down their stimulus, their tax returns and their stimulus payments, and sort of slowly drawing down their savings, a lot of the people on the UI benefits sort of kept their savings high, kept the amount of money in the bank. And then when the $600 a week died, they started drawing that down. And so so we're basically right now at the point at which people have like running out of the savings. So that anticipated fall in aggregate demand that we sort of anticipated, Paul Krugman said was going to happen at the end of July, hasn't happened because people are drawing down the savings that they made over the preceding 2 months, but we're headed there now. And that's all I got.
Wow, that's really, really interesting, Suresh. Thank you so much. Let me start off asking a couple questions,
maybe you could
and then
stop sharing the screen.
Oh yeah, I can stop sharing the screen.
So that we can see you. Good.
Yeah, thanks, Jeff. So, oh gosh, so one thing you threw up a lot that was very interesting. So one of the slides about the interest in union activism in the face of COVID, and the incredible similarity between people who, I guess they identify themselves as being Democrat or Republican. That's quite different from what we're seeing in other areas. So for example, Bob Shapiro, when he spoke on the webinar, was saying that, if I remember correctly, that people's understanding of things like science, or the trust that they put into science, including on COVID, really has strong connections with their political beliefs. So I would have thought that a person's interest in his or her health, self-preservation, family would be pretty uniform across humanity, and not vary so much with political ideology. And in a way, that's what you're saying, but the means to get to a safer outcome in your slide was about unionization. And that normally there's a clash, right, between Democrats and Republicans and how they perceive unions. So what's going on there, and how do
I think it's like once you're conditioning on these like essential workers that are not, so there's a big chunk of sorting where you have like, highly educated Democrats and business owning Republicans that have very divergent interests in terms of, if if I'm just like collecting money on my car dealership, that I don't need to, I would like that to be open. I would like to, versus, I work from home, or, so I think you can have these partisan differences in the whole population. But I think once you look at people that are like in a workplace and they're worried about being, and they're like seeing people face to face, and they're not necessarily choosing that, they're like, oh, I have to keep my job, I need my healthcare, et cetera. I think then kind of the much more mortal fears of getting infected kind of take over, and so you don't have, I think, the same population level political differences once you condition on people that are like at workplaces facing the same level of exposure risk. Now, of course, that's not a lot of overlap necessarily, right? Those people are going to be, there's plenty of sorting by job and partisan affiliation. But I think once you look at the segments that are overlapping in their like workplace experience, you kind of get more similar stated preferences.
So that's reassuring to me. But well, it is in a way. There's something that's common.
Well, but it's like that the sorting is so bad. I think it's like there's a lot of sorting, like that basically partisanship is incredibly correlated with occupation, and so that that maybe it's a misleading picture on this part, is that, oh yeah, once you look at these people that have overlapping risk of COVID, then you sort of see similar preferences, but that's a very narrow and special subset of the whole population.
Right. So, and what if that speaks to a broader issue about the sorting and political identification, and maybe a way to, I guess that creates a kind of a, so I tend to think about the political ideology as being kind of a mind game, but you're saying that's also very dependent on which part of the economy you're in, as it were, right? Probably the geography as well.
Yeah. There's like tons of, what Piketty.
So there's a structural component to this. Wow. Okay, so that's more worrying, because unless you can shift the structure. So I had another small question about essential workers, because they're essential. So essential workers should experience a wage increase, I would have thought, right? Have they? No. and why is that? Any idea?
So I think there's two things. There's like one is the product, quote unquote, the productivity of your own employer might not have might have fallen also. And so they're like, I would like to give you a raise, but I can't because I don't have any money. I think the bigger thing is also that you just can't leave. So like you're not eligible for UI if you voluntarily quit. And that's like just generically true in every country as a way to keep people from having too much choice. And so if you can't quit, then what's the actual micro mechanism of you getting that compensating differential? It's not there. It's
but
like
as you were saying before, you could get another employer to offer you a job, but that's maybe it's just hard to. I don't know. It's a little bit.
Reserve army of unemployed.
The reserve army of labor kind of reasserted itself.
Mass unemployment, most of it involuntary.
Jeff, you must have a question.
Yeah, Suresh, thanks for the wonderful work. Could you explain just the mechanics of the survey? How did you do the survey? How do you get a random sample? I think students would be interested, but I'm interested also.
Yeah. So we worked with a company called YouGov that is that this is kind of their business is and we were like very careful in kind of making sure that we were giving we looked up basically what had been classified as essential workers, like by industry sectors. And we asked them to like make representative samples from like this, their sampling frame looks like the CPS. We tell them you need to replicate the CPS proportions across these these surveys. And they say, we can do that. And then they basically have like this body of surveys, and they pay people to complete the surveys, and that's how they deliver like a representative product. I definitely worry that the things that had been done to validate YouGov just broke down during COVID, and so it's an open. I think we will be excavating what COVID did to our various data collection protocols for a long time going forward, but this is kind of done in the moment.
Our experience with YouGov is very positive, so I think they do a careful job. I wanted to ask you two questions about, I don't know whether you've collected data on it or not, but do you have, as part of the database, whether workers actually did get infected and what kinds of jobs led to infection and what kinds of protections avoided infection, if any?
We asked workers whether or not you had COVID, but we didn't ask, and I don't know that we should have asked, like, did you get it at work? Because how would you know? And we have that somewhere. We thought it was like less reliable than just looking at the local COVID incidence rate from the aggregate data.
I think it would still be worthwhile trying to see whether you find that certain classes of workers, whether it's retail sector or first responders or others, systematically show up as having been more infected, and
that's a good point.
Whether it's related to the fear of infection.
That we did find that like but we could have done it at the occupation level. Yeah, that's a good point. Yeah, we could have looked at that.
And then the second thing that I think is really a fundamental question. I don't know whether you're looking at it in this data or in these data or somewhere else. What will digital mean for the long-term change of the workforce? My feeling has been from the start that a significant proportion of these jobs will never come back because we will have moved to an online work environment. And there are several different components of that. One is e-commerce. That's not actually been the major source of job loss, but there's definitely something there. Second is whether there's a significant long-term change in the hospitality and leisure sector, mainly restaurants and others, versus at-home dining and delivery and so on. Third is offices are fundamentally going to change. And there's actually a lot of workers who are office support. And this is one of the biggest categories of decline of the labor force. And the fourth is whether there's a change of social service employment by shifting to online telemedicine, distance education, and so on. So I think the digital transformation is profound for at least for us, but I think it's a general pattern. And I wonder if you have some thoughts about what this will mean for the labor force more generally.
Yeah, so let me break it up into two parts. One of the transitory things around COVID that obviously we're all working from home. We think restaurants. I think we think restaurants somewhere are going to come back. Retail, and then versus long-term things that retail, brick and mortar retail was like declining as total employment when every other sector was increasing, even in 2016. So that's been kind of I think that's like a secular trend that COVID accelerated, but was kind of on its was on its way, was happening anyway. Was this big structural change in retail? So I think yes, there will probably be less cashiers going forward, but there will be much more delivery workers and pickers. And picking, which is what they call it in the Amazon warehouses, is like the act of fulfilling orders. And there's some judgment. It's interesting, particularly in grocery, particularly in other things, that it is not a completely, Amazon's is unskilled, but in groceries, there's actually some judgment in deciding what are close substitutes and adjudicating quality. And so it is, I think in that retail thing, there is a lot, it's a structural change. It's not clear it's on net going to be an employment loss. Because of like the army of 100,000 Instacart workers that are going to get employed as pickers and deliverers in this. Now the transitory stuff. So, and the other thing that I think is transitory, and I just don't know if it's going to be permanent, is kind of the if you will, the super high value added components of the U.S. economy. Think finance, legal services, tech, that are relocating out of major metropoles and have switched into work from home. If that persists, that's actually, I think, really great because it deconcentrates all the supporting services to like all over. So now you can have like people in a small town where they're supporting a group of software developers, and there's a whole like little cluster of services of restaurants and things servicing a cluster of people doing tradable services in a small town where rents are affordable, there's lots of housing available. And so you can imagine a scenario where like small town America gets reborn by like clusters of tradable services now leaving New York and San Francisco and going to work anywhere. And that would be, that's an optimistic, if you sort of thought that one of the big barriers to equality in the US economy was that so much economic activity was getting concentrated in these really overpriced cities so that it was squeezing out, there was just like no middle class in New York anymore, then this kind of taking of skilled tradable services and that includes telemedicine. So imagine that your doctors are now from South Dakota and they're just doing telemedicine, and there's like a whole small town supporting like a group of doctors doing telemedicine in South Dakota. That might be okay. It's so that's kind of like the yeah, and the other thing, I think it's like along with that would be like such a boom in construction labor. And just in terms of if like all the office real estate in New York, I don't think that's going to get unused. That's going to get repurposed. If that and that like kind of transformation of the real estate, both all over the country, would be kind of, I think we're already seeing like people want like larger living rooms. They want more furniture, and so I think like the construction sector boom, which is often like a good signal of like a tight low wage labor market, would also. So maybe I'm just perpetually optimistic. So I always get these things wrong because I'm just like, oh.
No. But I think it's really interesting to try to do the kind of net effects of this, because on several things that you mentioned, I think you're right on retrofitting of buildings, and probably some of New York office buildings will become part residential. It'll be a different kind of building. And that will, of course, use interesting employment. But building new commercial buildings almost surely is going to collapse for a while because we've got more real estate that is empty than is imaginable. So I'd like to work out the net effect of that. And on e-commerce, I think it's also very interesting. Is it just a shift? I would expect also that a lot of Amazon warehouses will become automated to the extent that they're not very soon. They are reaching about 1 million employment, I guess, in Amazon. So there has been an increase, but it's not so hard to automate or see how those fulfillment centers are going to be automated in the years ahead. In any event, seems to me to be a great time to be a labor economist. It's going to be an incredible structural change that is very deep and traceable, actually.
Yeah. I think the real-time data that has been produced in this crisis is just, I mean, as a social scientist, it's just the level of granularity that we're able to see this stuff in real time. It's kind of amazing.
Yanis.
Yeah, thanks, Jeff. Suresh, great presentation. I'm wondering if you could put up figure 3, because I have a question about that, and I would like people to see it if they don't remember it.
There we go.
So I thought that this was really interesting, that people who benefit from UI obviously have this huge margin compared to people who don't have the UI. And then what happens in July is that you have this really big decrease, like a larger slope, right, for the red line compared to the blue line. And it seems like it's going to touch in October. So first of all, I'd like to know, why is it that people who have benefited from the UI, after they stop benefiting from them, seem to have a higher expenditure? And then second, what do you think is going to happen after October? Do you think that that slope is going to steadily go back and match the blue line, or is it going to continue on its progression where it makes you think maybe it was better that they didn't get it in the first place because their expenditure rate is so much higher that, if they didn't get it in the first place, their expenditure would have been slower from April because they didn't have that extra income?
No. So sorry. I should be clear. This is end of week bank balances. So this is the amount in your bank, in your bank account at the end of the week. And so what's happening, right, is that those $600 checks that were getting deposited in your bank account stop, and at the end of July, and so you start drawing. So you start keeping you're keeping your spending sort of reasonably constant, but you're now drawing down the balances. So what you do see is also people drop their expenditure. I don't have that graph here. Is when the $600 gets cut off, people do drop their expenditure, but not completely. And so, which is what you'd expect. There's some consumption smoothing, and so people drop their consumption, but because they've been saving, because they've been anticipating that this expiration was going to happen. They've been saving, and so they don't cut their consumption that much. They just kind of cut it a bit, and then they're drawing down their bank balances. And so I think they will eventually, converge back, and then stay on the same path. But what's kind of bad about that is that there's now not going to be the stimulus value. There's just not the kind of aggregate demand shock. If what we would need, right, for recovery once the virus is built is kind of a big stimulus, given in the way of $600 a week to low-wage workers. That's very high marginal propensity to consume. That's a really big stimulus effect. We'd probably want that to happen, at least to keep the bottom from falling out even further, but that's not on the table. And so I think that so as people draw down,
the Senate had other priorities this week, so
What? Yeah. So that's going to be the big question, I think, for the next administration, whichever one it is what to do for the next round of relief slash stimulus. I mean, I just think of this graph and I just think of all the misery in the background. It's God, it's
right.
Terrible. It's
well, thank you.
Yeah.
So maybe get rid of that slide again so we can see you.
Yep.
So as you say, so we got thrown into this crisis, and then we have this kind of response from Congress that was initially quick and powerful, but short-lived. And now we're, yeah, as you say, Congress has other priorities. So there are two sides to this. I mean, one is, a bit like you were saying before, economists want to see variation, right? That's how we learn. And that a dramatic policy intervention, what is it that we learn from that in some kind of general way? Anything? And secondly, what's the kind of policy you think we should have? What would be, because this COVID is going to be with us for some time in some way. So what should we do?
So I think on the UI, on the unemployment insurance, I think one thing we learned, I think, is that, I mean, I kind of like this. People like low income workers aren't idiots. You give them this UI benefit, they save it because they anticipate it's not going to be there forever. And so like, they're not just like hand to mouth, like you just give them money and they'll spend it. They in fact save it. And so I think that's a useful one. The other, I mean, sort of tragic, but is that, there's always this debate in economics about whether or not by giving generous unemployment, you like incentivize people staying on unemployment. And when the thing you see about the expiration of benefits is just like, there's no employment response. So it's like no one is like, you're not seeing like offsetting inflows from paychecks. So, and so like basically you lose $600, you see bank balances fall by $600. And it's not being offset because people are now getting like jobs where they were before like living high on the hog. So I think those kind of two things are two things that I think we've learned about the kind of, and the shock just being massive means that like lots of small stuff that might confound things are just not on the table because of how large the shock is.
So one of the questions we got from one of the students was whether we learned that this stimulus package wasn't very effective for stimulating the economy. But your point is that, well, actually, it was a good thing that the workers saved because they knew that this is right. There was a limit on this and the economy was not changing. So they had to hold on to it. This is about personal survival. The idea of a stimulus is you're transforming a whole economy, but the economy isn't being transformed. You're just keeping some people their heads above water for some period of time.
So you should think of there being like two reasons why you want to give cash in a pandemic. One is like relief, just like if people can't work, if, just everything. It's a good rule. Like, yes, everybody has many, many constraints, and yes, everyone's circumstances are like a little bit different, but money is just plain cash is often the second best solution to every problem. So it's never the best solution, but it's often the second best solution. And so you want to just give relief. And I think that was a big chunk of the CARES Act. But the second thing is that once you get past the pandemic part, which we are not past yet, you want to then kind of get the economy back to full employment, and that sort of requires stimulus. And so there's a second reason to give money. The problem is we don't know when we've transitioned from like past the virus into stimulus. And on top of that, we have this politically uncertain environment where we don't know that we're going to get another bite of the apple to give money at all. So in some sense, like giving this like super dole at the beginning might have wound up being like even though it was done for not great reasons, might have wound up being actually like a pretty good policy ex post, because we let people save it, and so they can then individually make their own decisions about when to re-enter the workforce, and et cetera. So in some ways, like the super UI was like kind of I'll make a pitch for it being the best part of the CARES Act.
No, interesting.
I think what Suresh is saying is really important. We use the word stimulus in the U.S. in a very simple and naive way, and in this context, this was not stimulus for aggregate demand purposes. This was stimulus because the economy had been, by design, substantially shut down in order to suppress the transmission, but then people need to stay alive during that period. They have no income. So this was really income support and not aggregate demand. If we wanted only to, and there was no way to sustain output, it wasn't even the desire. The desire was to cut down production so that the viral transmission was reduced. But we're very, simple in the public discourse about what all of this means. Also, Americans hate income support. Stimulus is better political packaging. It's a more frequent term. It was also the term in early 2009 after the financial crisis, when it really was trying to boost spending again. So I think we're going to soon revisit these issues, but also in new ways. The thing I believe, although I'm hardly on the inside of this, but what held up the second round of this more than anything else was Trump's absolutely malevolent design not to fund blue cities. And so it was more, I'm not going to give any more help because that might go to New York. That might go to San Francisco. He says as much, pretty dramatically. And Biden's response to that is, I'm going to be a president for all America, is actually a appropriate, targeted response. But that's what held up the next round. What's weird about this from also a macro point of view, we have a city like ours, New York, that has an $8 to $10 billion budget deficit right now. What we know from a circumstance like this, both because this is temporary and because of aggregate demand considerations, you don't cut the budget because of a temporary shock like this. You fund the budget either through a transfer from the federal government or borrowing in the market or some other mechanism. But there are many voices, weirdly enough, saying, no, New York has to cut its budget right now. And that's literally leading to further dismissals of teachers, frontline workers, first responders, and so on, which is the worst of Hoover economics of cutting budgets in the Depression from a jobs point of view.
So here's a question about that, which is, why? It seems like the Fed has actually been like kind of the superstar performing organization here. Is there not a way for the Fed to make some sort of like special credit vehicle available to state and local?
Absolutely. In fact, they said that they were going to do so. And I thought it was obvious that New York should borrow at very low interest rates to fund this deficit, because frankly, what's 10 billion among friends in a city with 111 billionaires and with our economic and social needs? But immediately the billionaires got together and said, it would be completely irresponsible to borrow. We're not going to go back and impose the debt on the future. We'd rather impose the debt on poor children today. They didn't put it that way, but that's what their policy is. So we're in kind of a crazy environment where if we have some luck, next Tuesday, these issues will sort out. But my point was to say, we will have 3 reasons for fiscal policy coming up soon. One is to correct the fiscal federal situation where state and local governments can't borrow under the law typically without emergency response. Second will be income support. And third will be aggregate demand. Fourth, by the way, will be public investment for structural change. So there are at least 4 different categories for fiscal policy coming up. They'll all be called stimulus, I'm sure of it. There's massive intellectual confusion.
Yeah, there's also a way to go for it, Scott. Yeah.
Well, there's also a fifth. Andrew Wilson sent me a note. Andrew, I don't know if you're still around. I don't see you, but I think it's really important, and it relates to this idea of a stimulus, because I'll phrase it in my language right now, Andrew, and then you come back and correct me or add to it. that, this is not a normal situation. It's not just a normal shock like the financial crisis. We call that normal. This is how much the world has really changed. It's crazy. But it's a public health crisis. And if you're going to adopt an economic policy, obviously what Suresh's work is showing is people are farsighted, they're rational, at least in some respects. And if you're going to adopt the economic policy, you have to couple that with a public health policy. So if we want to restore the economy, Jeff's raising his hand, if you're going to restore the economy, you've got to do these two things at once. But instead, we have this this clownish atmosphere in Washington, at best, where the virus isn't being taken seriously, and that's undermining the whole the value, as it were, of the what would you call it? A kind of a, not a rescue package, because a rescue implies that you're actually going to save people, but all we're doing is we're giving them some money to last a little while, and the floods will just keep coming, and they're not able to get out of it.
It's been absolutely weird that in the discussion since March of this federal financing, the first category should have been, what do we need for emergency public health measures for containing the virus itself? And that category, the Democrats have tried to put that in so-so, because their main concern has been the workers and lost income and so on. The Republicans naturally wanted bailouts of the industry, but the category of how much should be spent on PPE, on contact tracing, on building public health teams, on funding cities and states to hire more people to do the public health interventions, that's hardly played a role from the start. It's incredible.
It's stunning. Andrew.
Yeah, this is just referring to a point that Joe Stiglitz made here 2 weeks ago, and it's a point that many people have made, but that prior to thinking about economic recovery, we have to address public health issues first. They're like a prerequisite in a sense, right? And so I guess my question, so it seems that we didn't do that, and my question is, as you say, this is one of the most progressive labor policies in a long time. And given that we didn't meet these prerequisite public health standards for economic recovery, how does that change public perception of policies like this? I mean, it will look like it was ineffective, and it cost a tremendous amount of money. And I just know in a year we're only going to be talking about debt. How do you think that changes things long term?
The fact that we haven't gotten the virus under control. Yeah, I don't actually know, because it's so politicized. I don't know if it'll be seen as, oh, that policy was a failure, or, oh, we actually just need another round of it. Until we get the virus under control. And so, for example, I think the idea is that we might not need another round of it because the vaccine will sort of miraculously happen in the next few months. So if we're looking out to end of next year for a vaccine at the earliest, which is sort of what I think is more reasonable, we're going to need another 6 months of holdover, or at least. And I'll just say this as yeah, as someone is with young kids, it's just it's something that's not sort of talked about in the UI space, but just when the schools are closed and you have to still work and do all this stuff, the opportunity cost of labor is just so much higher because of various home production things that need to get taken care of. And so the idea that you want to keep people from just going into any old crappy job, because there's in fact a super high value from household stuff in this context because of the shutdown of public goods that we rely on to provide that stuff. I think that's another reason why the super dole kind of thing is a good thing, is just the the opportunity cost of working is for parents is rarely leisure, it's household production. And the value of that stuff is like, it has shot up with school closures.
Great point. Great point. Can I ask just on this point about managing the economy and the public health simultaneously, which is obviously what we need. Is there a country you could look to that has done a good job at doing both?
I don't know enough of the I hear great things about South Korea and Taiwan, but I don't know enough of the details. I have enough of a hard time keeping like track of the policy environment in the U.S. these days that I was like, I've kind of have not been paying a lot of attention to other countries beyond what the news sort of says.
China would be comes to mind. Obviously, their economy is growing, as Joe Stiglitz told us 2 weeks ago. They controlled the virus very quickly, and now they have growth. South Korea, Taiwan, I think were good examples. New Zealand, Australia.
Yeah, so I think the reason I point to Taiwan and South Korea is like countries that did it without necessarily like very ham-fisted.
You are right.
Like you can imagine the U.S. doing things like South Korea and Taiwan. You could have a harder time imagining the U.S. doing things like China.
You are right.
I'm having a hard time imagining the U.S. doing something like South Korea
or Germany, even.
Or Germany,
and that is sad because we used to, 4 years ago, be able to do something like South Korea.
I know. It's shocking. It's stunning. Jeff Sachs mentioned at one of the earlier meetings that at one point there was some group, Jeff, that looked around the world about which country was the most prepared for a pandemic, and I think you said the U.S. was number one.
Yeah, that was the Hopkins Index of preparedness.
Right. Well, maybe
almost upside down.
Yeah, but maybe that would have been true in that previous world, and things have transformed so much in the U.S. that's a measure of how far we've fallen. Yeah. Really amazing. Anyone else have a question? Or Suresh, is there anything you want to add?
Excess profits tax to pay for it all. That's all.
Okay, that's a good point. Because I'd asked you before about a policy change. We're in a crisis, which, as Rahm Emanuel told us, is an opportunity.
I mean, it's like World War I, World War II. There's excess profit taxes on like all the war supplying industries. And if you thought logistics and delivery at home was like our equivalent of wartime industries during a pandemic, then it's like, cool, you guys are making out like the idea of like taxing them to keep their profits the same as they were in a non-crisis environment. Not a bad idea.
So it doesn't sound like a Republican strategy to me, but is there?
I mean, they hate what they. It's not clear that they. It's not clear that Trump would be so opposed to like an excess profits tax on Amazon.
On Amazon, right? It'd be selective. It would have to be especially it's a personal tax. It's like so many things. All right. Well, it's been great. I really appreciate it.
Thanks a lot for having me.
Really valuable.
Fantastic work, Suresh, and lots of interesting work ahead. It's going to remain a very complex policy environment and labor market environment. So we're going to look forward to hearing the next phase of your research.
Yeah, thanks a lot. Bye, guys.
Thanks, everybody.
Take care. Thank you.
Sure.